This is Dr. Alan Jacobs of the Arthritis Center of Nebraska talking about rheumatoid arthritis. This is the most common of all of the inflammatory forms of arthritis and is much different than osteoarthritis. It is an autoimmune disease that is not related to one's age, so it can occur in a 5-year-old, 15-year-old, 55 or 85-year-old person. It produces symptoms of swelling, stiffness, and pain in the joints, especially in the morning. The joints are often very swollen, and it's quite visible to many of those affected. The swelling tends to be worse in the morning, in addition to the pain and stiffness, and may improve a bit as the day goes on. The cause of rheumatoid arthritis is a flaw in the immune system. The immune system misbehaves and begins to behave as if there were an infection in the joint. These immune changes are seen in abnormal blood results, particularly the abnormal antibody test called the rheumatoid factor and anti-CCP antibody. In the joint itself, there is soft tissue swelling on the sides of the joint in the soft tissue layer called the synovium. There's marked inflammation which leads to the swelling, stiffness, and pain and may produce fluid inside the joint. When the inflammation persists on a chronic basis, it may do considerable damage to the joint itself. The laboratory studies are very helpful, and also the examination of fluid from a joint may show very characteristic findings of inflammatory arthritis, which would be much different than that seen in osteoarthritis. The laboratory studies in osteoarthritis are normal. Rheumatoid arthritis often starts in many joints all at once, especially the small joints, including the fingers, wrists, and feet, and is always symmetrical with both right and left side being involved simultaneously. People with rheumatoid arthritis may have systemic illness. They may have elevated inflammatory test results in their lab tests, including the ESR or SED rate, and also the CRP or C-reactive protein. There can be anemia and other blood count changes. There may be subcutaneous nodules, as well as symptoms of Sjogren's syndrome, lung problems, neuropathy, and vasculitis. An example of these nodules are shown in the diagram with the small tumors, especially along the elbows and also found in the fingers, but they can be found almost anywhere and be quite a nuisance to some people. People may have a lot of mouth and eye dryness with what's called Sjogren's syndrome. Some individuals may have breathing problems, and the chest x-ray may show abnormalities that could be quite worrisome. The extremities, especially the feet, may have numbness and tingling with what is called a neuropathy. All parts of the joints can be damaged by the chronic inflammation. There can be erosions in the bone, there can be loss of the cartilage surface, and there's also possible damage to the ligaments and joint capsule. An X-ray may show a large hole or divot called an erosion taken out of the bone right next to the joint. There is loss of the white cartilage surface that provides the shock absorber and has a lubricated surface to allow our joints, and that can be considerably or totally destroyed. And there can be looseness of the tissue holding the joint together, leading to joint deformities. There are permanent changes possible with rheumatoid arthritis with certain classic features, especially in the hand. The fingers tend to drift to the outside, called the ulnar deviation deformity, and there can be major abnormalities in the distal joints as well as both wrists. The one thing about rheumatoid arthritis that is especially different compared to osteoarthritis is that the prognosis is now considered to be very good. That is, provided there is an early diagnosis and provided there is early aggressive treatment to prevent joint damage. This has been Dr. Alan Jacobs of the Arthritis Center of Nebraska.